The biggest strength of CHIOs is their ability to create a conversation table, a conversation round table of important stakeholders regarding the health of a county or a region, a community in the state. That's rare. It is really rare. There are some agencies like the Public Health Department. There are provider systems like hospitals and healthcare systems. There are clinicians. There are social service and public service agencies. All of them contribute to health, but unfortunately we tend to get somewhat siloed and busy on our own ways that we don't come together and actually tell each other what we're doing and find out how we can be helpful to each other.
Right.
The biggest challenge is getting enough people with enough time and energy to work on something that's novel and effective.
All of those that are on the coalition are volunteers, so it's really hard to keep them going. We do have some paid staff through the grants that's been received as a part of being a CHIO, but for the most part, they're volunteers. So
it's taken a long time to get the healthcare providers, the hospitals, the public health enterprise, and the rest of the community, the economic arm of the community together to actually look at what it wants to do in health.
Having hospitals as a partner is great. I would encourage anyone that doesn't already have that relationship with their local hospital or hospitals, depending on what community you're in, to approach the CEO or the Vice President of Operations, or even the Director of Community Benefit, and ask them, how you might be able to work on some initiatives together and partner.
I think bringing in the physicians has been a huge strength, with ones that maybe not necessarily on the CHIO coalition board or a member, but those that are participating in the Healthy Hearts for Oklahoma project. We've voted to actually give back to the practices that were participating in the Healthy Hearts for Oklahoma. So the Tri-County CHIO received $11,000, and we used that money to give back to 8 clinics that were still participating. And we had what we call a cookie sheet, where they were able to choose what items they would like that would best fit their patients that they had in their practice. So we had a very good response on that. And it kind of encourages other practices to maybe participate in future projects.
But one of the activities one of the CHIOs has performed is actually putting together resources for underserved patients. So diabetic patients need testing equipment, and they may not be able to afford it. We do know that patients with high blood pressure who engage in monitoring their own blood pressure do better. So in those 2 cases, one CHIO has taken on raising the funds to purchase these kits and make them available to patients through the clinician's office. First of all, it begins to bond the clinician with the CHIO, and it provides a definite service to people in the community.
I'm a practice enhancement assistant, and so we all go to the CHIO meetings and listen in and see how we can better help the community and help with the projects that they have.
The major thing that I've seen work is in the H2O project, where the practice facilitators and the practice facilitator coordinators get to know the primary care practices in the region and engage them in the CHIO activities. So the facilitators may go to the CHIO meeting and then bring the information from the CHIO meeting to the practice, helping the practice make better referrals and make better use of social services that are available.
We were fortunate because our CHIO had a really good infrastructure before I started. So I've been here about 2.5 years now as their executive director. Prior to that, they had already done one community health needs assessment and developed a chip off of that prior to me starting. So I started kind of in the middle of that. So in that process, 3 years ago now, our president of our employed physician group of Duncan Regional Hospital actually had been a part of that original assessment and planning piece. And so he was already, when he was already on board, and when they applied for their 501c3, he was one of the board members originally. The Chief Information Officer, Vice President of Operations, dual role of Duncan Regional Hospital, is who had the original relationship with him and approached him to be able to have primary care physicians have a voice at the table because of all the work that we were going to be doing. I have brought some other practitioners on, and they work under our mental health task force.
Okay.
So that is one of our priority areas for our CHIP. We do have 3 physicians that work on our mental health task force and attend those meetings regularly every month.
Gotcha.
And when they were approached specifically to include physicians in what we as a CHIO were looking at doing in the community, and knew that we were going to have to involve our physicians at some level.
A couple of the partners have been the emergency services within the county. So you can think of the police and the fire, and in some of these small rural counties, the fire companies are volunteer fire companies. So the first responders become really very important. I think the CHIOs that have pharmacists on them are an important contributor to the overall health of the community. I believe there was one meeting I went to where there was an educator on the CHIO, a public school administrator.
Have someone that's actually kind of they're living it, breathing it, what they do every day, and then they can bring that expert advice to us to the table. Not just us conceptually sitting around a table talking about a challenge that we're trying to address, and not having the content experts there to tell us, here's what we see from our perspective. We have one that has kind of surprised a few people, but at the same time they understand, I guess it was kind of my approach behind it, and then some of my board members also agreed, and we approached this particular business in our community. Actually is a wine shop and liquor store. And so their manager of the store is actually one of my newest board members.
Wow.
And so we went to her. 2 of my board members knew her very well in the community. Very, very respected person as a business person in the community. Has a great personality as well, so she's very approachable. And because we do so much around youth and adult alcohol use and abuse, as well as our other substance abuses, why don't we bring somebody to the table that is front and center of that industry, and what do you all do? And how do you protect the consumer, or what measures do you all take as a business to make sure you're doing everything right in our community?
Let them know that there's people out there that do care, and we really want to find out what it is that we can do to help them.
Let them see this is going on throughout the state. So I really like that part. I like educating people about what Pathways is and what we do and what we're working on, and recruiting new people that have that same passion to come help us. So I love it when we get new members, whether they're a new board member or if it's a new community partner that wants to come in and has a passion for one of the priority areas that we're working on. So that's always exciting. Yes.